Yes, ma'am.
What was the last subject that we have reviewed?
Occurrence
Occurrence of disease.
Occurrence of disease.
For me, yes?
Yeah.
For my session.
Yes.
Yeah.
Yes. But Dr. Oslovar explained you some measures of associations. Yes? Okay. We studied to answer the questions. Yes? Some questions in the field of medicine and public health. We can answer to different questions. We cannot answer to the same questions by, for example, different types of studies. What does it mean? If I want to categorize the study design into two main categories, we have descriptive studies and analytical studies. In descriptive studies, as the name shows us, it just describes something. For example, who are affected by, for example, this virus? Then we can be diseased. In which season? In which month? Or something like that. But for analytical studies, we can access the associations. In these types of studies, we just explain, for example, this disease is more prevalent among obese population. This disease is more prevalent among men. But we cannot say anything about why. If we want to answer the question, why this disease is more prevalent in men, we should do analytical studies. Okay? So, the main difference between descriptive and analytical studies is the ability to answer the questions. We cannot answer to the why question in descriptive because we just explain, we just describe some facts. But in analytical, we can explain more, assess the relationship, and answer to the why question. In analytical studies, we have two main categories: observational studies and experimental studies. In observational study, we observe some population by different way. We can review today. But in experimental, we do some experiments. We have some intervention. For example, do intervention for this group without intervention this group. We have two groups, one of them has intervention and one of them has no intervention. So the difference between these two is having intervention or not. Okay? In observational studies, we have cohort study, case control study, and cross-sectional study. And in analytical study, the main category is RCT, or randomized clinical trial, controlled trial. Okay? We will review these study types in our today's session. What is this? It is a pyramid levels of evidence and study design. Based on the design, the different studies have different abilities to answer to the why question. The main goal to do a study is to answer, for example, is this material, for example, is this subject, is a cause of, for example, that disease or not. Because causality is the most important question for us. Okay? But based on the abilities of these studies to answer to the causal question, the levels of evidence that are provided by these studies are different. The most important and strong study is RCT. Why? We will review today. Animal and laboratory study is the weakest. Okay? Case report or case series, case control studies, cohort studies, and randomized control trial are in order. So the strongest is randomized control trial. As you can see, case report or case series has no design. Why? Because these studies are descriptive. Without any design, we can just explain some facts about our study population. And case control and cohort study, as you may remember, they are non-experimental observational study, and it is experimental study. So, the level of evidence can show us the strengths of study design. As I told you, descriptive epidemiology never tries to answer the why question. Okay. The types of descriptive studies, different type, answer to these questions: time, place, and person. When somebody can be diseased, where the disease is more prevalent, who are affected and can be diseased. Okay? So we describe time, place, and person in these types of studies. We have 4 types of descriptive studies: case report, case series, ecologic studies, and cross-sectional studies. Cross-sectional studies has 2 aspects. It can be both analytic and descriptive. How? We will review. The main categories of descriptive are case reports, case series, and ecology, and sometimes cross-sectional. Okay? What is case report? It is clear. Case report. You are medical students. In your office and in your practice, you may face a strange case with strange symptoms, with unusual symptoms and signs. You may have many problems to diagnose this disease. After finalizing your explanation, your diagnosis, you may want to distribute your experience with the other physician and add something to the text, for example. If you don't know that, for example, brucellosis may have these types of symptoms, I know right now, based on my experience, based on a case that I have been struggled with. Yes? It is a kind of case report. You may have case report, for example, in your courses, because when you enter to the field, for example, to the hospital, in externship or internship, you may have some interesting cases, and you may have case report at in the morning and present, for example, your strange cases for the other students. These types of studies report and explaining some strange cases named as case report. It is important because you may suggest a new hypothesis by a case report study. Why? Because you may think that, for example, this disease can be related, for example, to death. Why? Because I see in my patient. But you don't have any control. Based on this, it has the lowest strength. It is just description, because you don't have any control group. Yes? A case series is a report on the characteristics of a group, a case series of a group of subjects who all have a particular disease or condition. For example, I, as a physician, can see that, for example, some patients have some similar symptoms, and I know that something is prevalent right now in my community, but I don't know what it is. I can just explain and share my experience to the other population. One of the most important case report is diagnosis of HIV and AIDS. In 1983, the AIDS was not diagnosed at that time, but there was an interesting experience by some physician. How? One infant was born with a kind of blood disease. Infant has Rh incompatibility. It is a kind of blood disease, and the patient needed some blood transfusion. Based on his medical situation, blood transfusion was occurred by 18 blood donor. Okay? After a while, the baby has some symptoms related to immunodeficiency. the level of T cell in his blood was decreased, and the physician was surprised. Why is the reason behind this kind of immunosuppression? After a while, they found that one of the 18 donors, has HIV, and they found that HIV virus can be transmitted by blood transfusion, because at that moment the only route of HIV transmission was sexual transmission. They didn't know that HIV can be transmitted by blood. But based on this experience, based on this report, they generated a new hypothesis about the transmitting of HIV by blood. It is a usage of case report. But case series is a report of some serial diseases, okay? Some serial patients.
Actually, my question is like case report. It is based on the individual level observation, as you told. So it does not involve the community. Like if it does not involve the community, we can have the different physicians who will approach the disease in their own ways. So how is this study beneficial for the epidemiological case?
Sometimes it doesn't need to communicate many physicians, many researchers in one study. You just explain your experience to the other population, to the other scientific community, to share your experience for further investigation. If I tell you that, for example, this disease can be transmitted by blood transfusion, you may design some studies to answer to this question. If the HIV can be transmitted by blood transfusion or not. After designing a well-organized study, you may answer to this question. But it is just making a hypothesis for further studies.
Just for a single individual.
Yes.
And series is when a group of individuals give their own hypothesis.
Yes. A case series is a report on the characteristics of a group of subjects who all have a particular disease or condition. Discovery of HIV in the United States is an example of a case series. How? Because some different physicians in different locations reported that they have some men who had some strange symptoms such as recurrent pneumonia by pneumocystis carinii. It is an unusual pneumonia, and the man seemed very healthy. This kind of pneumonia is a kind of immunosuppressive disease. At that moment, HIV was not diagnosed, and the physicians were surprised about the reason behind this type of immunodeficiency. After a while, they searched about the characteristics of those men, and they found that all of them were homosexual. And they found that it is something related to the homosexuality. They searched a lot and they found that the reason behind this is a kind of virus and named it as HIV. So these types of case series helped the physician, the researcher, to diagnose a new syndrome that was HIV. Okay? It is the paper related to that. Pneumocystis carinii pneumonia and mucosal candidiasis in previously healthy homosexual men. Evidence of a new acquired cellular immunodeficiency. It has been published in one of the most famous journals in medicine. Okay, so the main objectives of case report and case series is to provide a comprehensive and detailed description of the cases under observation. Okay?
Yes.
What are the advantages of case series and case reports? Tell me your opinion. What are the advantages of these two simple study designs?
We'll understand what is the main cause of this disease. Like you said that HIV virus, it is also spread by blood transfusion. Yes.
Yes, it can make us some new hypotheses about different questions.
Like both of them can play a key role in finding the variety of new diseases. As you told, that case series was a milestone in finding the HIV. Similarly, it will be used in the good way. We can have it as a tool of the epidemiological studies as well. And besides that, I guess it's simple. In most of the areas, you can just went to the doctor and take his observations. So it will give you much more than rather just going to different individuals taking their opinion. It is a simpler option out there.
Yes,
So
it's
it will-
simple.
Yeah. And
Do
these
you
are.
agree? Yes, it is simple. It is cheap. It doesn't need much money, much financial resources or something like that, because you just describe your experiences. Okay? And it is easy to conduct. But as I told you before, since you do not have any comparison group, you cannot say something with strength. Yes? Because you are in doubt every time. You can just explain why? Because it wants to generate a hypothesis for further study. Okay. The last disadvantage is the biased selection of cases. What does it mean? It means that it is just my experience in my case. If I tell you that, for example, fever might be seen, for example, in such a disease, your patient might have no experience of, for example, fever. It is not a rule, it is not routine, it is just my experience and I want to share it with you, just because to be cautious in your course of, for example, diagnosis of such a diseases. Okay? But what is ecological study? Here you can see a graph. Nobel Prize, the number of Nobel Prize, and and the chocolate consumption. Here you can see the results of a study. You can see that more chocolate consumption per capita in a country, higher number of Nobel Prize. Less chocolate consumption, lower Nobel Prize. It means that if the chocolate consumption, very good news, yes, for me that I love chocolate.
You are in higher Nobel Prize. You got higher Nobel Prize.
If the chocolate consumption is higher, the chance of Nobel Prize is higher. It is the result of this study. But you can see here that the points are not individuals. The points are countries. Yes? In a study, in different study design that we will review in this session, we have some individuals in our study. For example, I have 200, for example, medical students in my study, and I want to, for example, ask them about their quality of life and assess if their quality of life is related, for example, to their scores, remarks in the final exams or not. So my subjects are individuals, but here subjects are not individuals, are countries. Why? Because chocolate consumption is a summary measure related to China. What does it mean? It means that based on some documents in China, they know that what is the chocolate consumption per capita. Average chocolate consumption in China, for example, is, for example, 1 kilogram per year. But in Switzerland, for example, is 12 kilogram per year. So these results are summary measures of some individuals in those countries. But I put that number for countries here. So what does it mean? It means that in ecological study, at least one variable is related to the level higher than individual. Let me explain more by another example.
Yes,
You are, for example, 30 students right now. Okay? I want to design a study to check the association between body weight, for example, and IQ. Okay? I can design a study in the individual level and weigh you and fill in the questionnaire to assess your IQ and compare your body weight with, for example, your IQ. But it is individual level, okay? But sometimes I may have design an ecologic study. We have, for example, 40 classes in Tehran University of Medical Sciences. Okay? I summarize your weight and your IQ measure as an indicator of your class. The mean body weight of your class, for example, is 67, and your IQ, mean level of IQ is, for example, 100.
Yeah.
Are you happy with 100?
Yes.
Okay. I do this approach for the 39 classes as well. So I have 40 BMI measure, body weight measure, and 40 IQ measure. And after that, I can compare these two variables that is not individual level. It is related to a class. The per capita consumption of chocolate was related to China, was related to Switzerland. It comes from the per capita consumption of you, and it was a summary measure, such as body that I explained you in the previous example. Okay? So, in the ecological study, at least one variable is measured at the group level, such as IQ in 40 classes, such as body weight in 40 classes. So, in ecologic study, I have 40 numbers, for example, in the horizontal axis. What are these numbers? The average IQ in 40 classes. Okay? And what is the vertical line? 40 values of BMI, of body weight in 40 classes. And after that, I can make a graph and shows the relation between IQ and body weight, but the points are related to a class, not to the individuals. Okay? It is.
So you said that traits of the many groups is compared. Like how are traits chosen? On what basis? Because what you choose first was the chocolates, and they are uncomparable. Like how are they? Like that's why.
Okay.
Or
Let me explain in the next slides. Okay. We have three types of ecological variables. The first one is aggregate variable that I made you an example about IQ and about body weight. It is a kind of aggregate variable. Why? Because the average weight comes from aggregation of your body weights. Okay? The second is environmental variable. What does it mean? A measure of the physical characteristics of the environment. For example, a geographical location in which people reside. For example, air pollution. Air pollution is not the individual variable. It is related to the environment. Air pollution in, for example, this district is the same for you, and the other person. So, please imagine you want to test a hypothesis about the relation of air pollution and, for example, cardiovascular disease. You may use the data available from the air agencies that air pollution data are recorded in those centers. Okay? For example, you may use the data of air pollution from 200 cities, different cities. Okay? And on the other hand, you know the rate of myocardial infarction in those cities. And after that, you may plot those information, the rate of cardiovascular disease and the rate of air pollution, and the points are 200 points. Which points? The cities. So, your subjects are not humans, are not individuals. Your subjects are cities. Okay? The other types of variable is global variable, such as different policies. For example, fastening seatbelt. Okay? Or using cap in motorcycle driving or something like that. Okay? There are many data available on the net from WHO, World Health Organization, about policies in different countries, if fastening seatbelt is necessary or not. On the other hand, you can use, for example, data available on WHO sites about the accidents in different countries. And you may use this information and find any relationship between availability of these policies in different countries and a mortality rate from, for example, car accident or something like that. Okay?
Yes.
This type of a study is ecological study. So, it is, I told you that it is a kind of descriptive study.
Yes.
Yes?
Yes.
You just use this type of a study to make a hypothesis for further studies. Okay? An ecologic study does not itself demonstrate that a causal relationship exists. Why? Think about it. The first
Because we don't
example.
because we don't have the mutual traits within the groups. So definitely there will be no casual comparisons as well.
But how it can affect my result?
Which way?
Having no individual.
Can you repeat the question?
Using a group level data has some limitation. What is
We
it?
can get the common source which is affecting the whole group. So by finding that we can seize or control that. By that we can resolve the community level problems, not the individual level. Because for individual level we have case supporting it, case series as well.
Any other idea? Don't you have any idea about the disadvantage or limitation of ecological study? In this example, I told you that chocolate consumption, average chocolate consumption in each country has the positive relationship with Nobel Prize. But is it necessary that a person who consumes more chocolate, who is the guy who gave a Nobel Prize? No, it is not necessary because it is a summary measure of all population in a country. Yes? Please let me explain another example. Based on a previous article, it was documented that we have Catholic countries and Protestant countries. It was documented that the rate of suicide is higher in Protestant countries. And the researchers told that if a person is Protestant, the chance of suicide is higher in that person. But after a while, the other researchers searched the documents and saw that although the rate of suicide in Protestant countries are higher, suicides are occurred among Catholic persons in the Protestant countries. Why? Because of the isolation, because of the stigma, because of the socio-economic level or something like that. So, it is an important point. You cannot use the result of ecology study and extrapolate it to the individual level. It means that it is not necessary that Nobel Prize winner is who consumed more chocolate. Maybe he consumes less. Yes? So, since the variable in the ecological study is higher than individual level, it is related to a community, it is related to a group, you cannot extrapolate the result to the individual level. It is very important limitation and weakness that we name it as ecologic fallacy. Okay? See this example. Per capita sugar consumption and age-adjusted prostate cancer mortality. The figure shows us that if sugar consumption is higher, the mortality rate from prostate cancer might be higher because the direct association, positive association is seen here. Okay? Per capita sugar consumption. It means the average sugar consumption. But it is not necessary that who has died from prostate cancer is who consumed more sugar. Maybe the person who consumed less sugar has been died by prostate cancer. Okay? So, we cannot say that if the patient consumes more sugar, the probability of dying of prostate cancer is higher. This interpretation is incorrect. Okay? We cannot extrapolate to to the individual level. Okay? Can we have a break? Break? Okay, 5 minutes. Which study different? Where were you up to now?
Ecological.
Three.
3.
Case study.
Case report,
Series.
case series, and ecological studies.
Yes, very good. These are
Descriptive.
3 types of descriptive studies, okay? The other descriptive study that can be both descriptive and analytic is cross-sectional study. We want to review this type of study right now. They promised me to come back 5 minutes later, but cross-sectional study. I told you that it can be both descriptive and analytic. Think that you are studying child obesity. A descriptive study for child obesity might look at the prevalence of obesity, of child obesity. In the prevalence, you may just have some children and calculate, measure their weight and find who are obese and who are not. Yes? And after finalizing the study, you may say that, for example, among 100 children, 20 were obese. It means that the prevalence of obesity is 20%. It is a kind of descriptive study. Just describe the prevalence of child obesity among children. Yes? But can we say that why these individuals are obese? Based on these explanations, we cannot say the reason behind it. Yes? If we want to ask some questions, for example, about their habits, about their nutritional habits, about, for example, smoking in their parents, about something like that. Measure this information, ask this information, and do some statistical analysis and find the relationship between, for example, being passive smoker and obesity. We may have some analysis to answer the question about the probable causes of child obesity. In this scenario, the cross-sectional study may be analytical study. Okay? But if we want to just explain the prevalence and explain, for example, who are more prevalent to be obese. For example, the prevalence of obesity in men, in boys, are, for example, between 10% to 50%. But among girls are between, for example, 50 to 25. I just explained the prevalence in men and women, in boys and girls. But I don't know
Why so?
if the reason of this difference is different sex or, for example, different nutritional habits or something like that. if I want to make further analysis and answer to this question, cross-sectional study might be analytic. But if I stop at describing the population and just explain the prevalence of child obesity among them, it is a kind of descriptive study. So, based on the questions that you are trying to answer in a cross-sectional study, different designs might be assumed. Okay? Cross-sectional study is the most appropriate design to find prevalence. What does cross-sectional mean? It is a kind of snapshot. It is a kind of photo. I want to estimate the prevalence of, for example, smoking among medical students. I can go to a university and make a representative sample of medical university students and ask them some question about smoking. For example, I ask 100 students, among them 30 are smokers. The prevalence could be 30%. Okay? In the best scenario, to have the best estimation, it is the final goal of, for example, a study. I can go to, for example, if we have 1,000 medical students. Sorry. If I ask about the smoking habits from all 1,000 students, it is not a kind of estimation. It is a kind of calculation, because I ask all population about their habits. Yes, but it is not feasible. For example, if I want to estimate the prevalence of hypertension in Iran, we have 80 million population. It is not applicable to go to the all 80 million population's home and measure their blood pressure. So it is necessary to have some sample. But it is so important to have the best representative sample. If I want to, for example, measure the prevalence of smoking among medical students, and I think that the prevalence might be different among international students and national students, my sample should be representative. If, for example, among all medical students in Tehran University, for example, 10% are international, in my sample, 10% should be international, and 90% should be, for example, from Iranian population. Okay? So, sampling is the most important part in a cross-sectional study, and to have the best estimation of prevalence, the sampling method should be appropriate. Okay? So,
My question is like, what is the application of cross-sectional study in observational studies when we have coherent study for the better exposure and non-exposure study? Like, then what's the application of cross-section?
I told you that the best method to answer the question of prevalence is cross-sectional study. In cross-sectional study, to initially investigate the association between a specific exposure and a disease of interest. Okay? I told you about child obesity and explained the difference between descriptive and analytic approach in a cross-sectional study using that example. Okay? Think about you are interested in the possible relationship of increased cholesterol level, that is the exposure, to EKG evidence of coronary heart disease, CHD. What does it mean? In analytic approach of cross-sectional study, I want to assess the relationship between cholesterol level and cardiovascular disease. How can I design a cross-sectional study to test this association? I should go to a population and select some population. Okay, for example, from elderly population, because I know that CHD is more prevalent among elderly population. Okay,
Yes.
for example, go to the park, go to the community, and select some elderly population without any criteria. Okay, for example, they are over 60, for example, and ask them about the previous history of hypercholesterolemia. On the other hand, I test them for cholesterol level. For example, I ask them to go to the laboratory and have blood tests for measuring the cholesterol level. On the other hand, I send them to the hospital to have some EKG and some measurements to finalize if they are diseased, CHD disease or not. Based on these, cholesterol level is exposure, my interested exposure, because I want to test the association of cholesterol level and CHD. CHD is the disease. Yes?
Yes.
So, based on this approach, we have 4 categories. Some of our elderly population have normal cholesterol level. Some of them have hypercholesterolemia. Some of them are CHD diseased and some of them are not. So we have 4 categories, 2 different categories considering exposure status, 2 different categories considering disease status. Okay, please let me explain this in the next slide.
Ma'am, can we say that cross-sectional study is the semi-coherent study? Because coherent study.
Cohort.
Cohort?
Cohort study.
No, it is not.
Because here we study also about the non-exposure agents. Here we study just about the exposure.
Yes.
So,
Exposure and outcome, exposure and disease is 2 important words that you may struggle with in the all study design. In cohort study, you may start with a cross-sectional study and after that follow them for a while. In the next session, we will review cohort study and tell you the differences and the similarities between these 2 designs. Okay?
okay, ma'am.
Okay. So, in cross-sectional study, you begin with cross-sectional sample, such as, for example, elderly population that you are interested in testing, for example, the association between cholesterol level and CHD. After that, you should determine exposure and disease at the same time. It is so important at the same time. Why? Because you go to the park and ask the elderly population to come to the hospital for testing blood cholesterol level and also having or not cardiovascular disease. Both of them are calculated, are measured, are assessed at the same time. Okay? So, based on these, we have two disease categories, diseased and healthy, and about exposure, positive exposure and negative exposure. Okay? So, we have exposed disease, means A, exposed no disease, B, not exposed disease, C, and not exposed no disease, D. 4 categories, okay? So, we start with defined population, gather data on exposure and disease, and categorize our study population to 4 groups. Okay? Is it clear? Based on this approach, you cannot say anything about the temporality. What does it mean? For being a cause of disease, exposure should be happened before disease. Yes? To be a cause. If a smoking is related to lung cancer, being a smoker should be occurred before incidence of lung cancer. But in this approach, you cannot find that if exposure, for example, blood cholesterol, is before CHD or not. Why? Because you assess these exposures and outcomes at the same time. You cannot say anything about the priority of cholesterol level and increased cholesterol level before CHD, because you don't know what is the exact time of hypercholesterolemia. What is the exact time of cardiovascular disease? Yes? Please imagine a situation in which you can see a broken window and a stone behind it. Okay? You may think that this stone is a cause of brokening this window, but you are not sure because you didn't see the process of breaking. Yes? But sometimes it is a snapshot, it is a photo, it is a picture, it is a cross-section of the study. Why? Because you just assess the hypercholesterolemia and CVD at the same time. It is a kind of photography. But sometimes you see a window that is not broken and a boy that has a stone in his hand and wants to break the window. You can see the process. So the stone is before the breaking the window. Okay? And you can see that the boy through the stone and break the window. The stone is the cause of breaking window. It is totally different. This type of a study design is a cohort. We will review it in the next session. So, cohort study is a type of movie because you see the process. You are sure, you can make sure that disease happens due to risk factor. So, temporality, the priority of risk factor compared to the disease is certainly occurred in cohort study, but in cross-sectional temporality is not clear for us. Okay? On the other hand, in addition to temporal bias, we have selection bias or survival bias. We want to assess the relationship between cholesterol level and CHE. But when I go to the community, I just can test the survived patient. Yes? The severe form of patients have been died before. So I have no option to test the relationship between severe disease and cholesterol level. Why? Because they dead. Yes? So in this type of a study, we have selection bias because we can just select the milder form of a disease because the severe form have died. So these two disadvantages are related to cross-sectional study. Here, if we compare exposed have disease with not exposed have disease and say that the proportion of disease among exposed are higher than the proportion of disease among not exposed, it means that exposure has positive relation with disease. But sometimes you may find that the proportion of disease in exposed is the same with the proportion of disease in not exposed. It means that there is no relationship between exposure and disease. Sometimes the proportion of disease in exposed is less than the proportion of disease in not exposed. It means that exposure has negative association with the disease. For example, physical activity. If the exposure is physical activity, we think that the proportion of, for example, cardiovascular disease in exposed who are physically active is less than not exposed who are not physically active. So the association and the direction of association can be tested in this type of study. If we design some similar cross-sectional study during different point of time, we might have repeated survey and investigate the trend of a disease, for example, in our community. For example, if we design a cross-sectional study in 2010 with the same approach, with the same design, repeated, for example, in 2015, in 2020, in 2025, and assess the prevalence of child obesity, for example. After 20 years, we can say that the prevalence of child obesity in our community is increased during this time or is decreased during this time. Okay? So repeated survey is so important to answer to the questions regarding the trend of risk factors, the trend of a disease in our community. Here, you can see this in a graph. The prevalence of diabetes, for example, in a community between 1992 to 2012. And you can see that the prevalence of diabetes is increasing. Okay? I told it before. Here we have 4 cells, A, B, C, D, who are exposed A plus B.
Second.
Yes?
Yes.
Who are not exposed
C, D.
C plus D. Who are diseased A plus C. Who are not no diseased B plus D. So, prevalence of disease in exposed. When I ask you in exposed, it means that the numerator is A plus B. A plus B. Prevalence of disease among A plus B, these are diseased. It means A divided by A plus B is the prevalence of disease in exposed. Okay? Versus C divided by C plus D.
Not exposed.
Prevalence of disease among not exposed. On the other hand, we can calculate prevalence of exposed among diseased. Who are diseased? A plus C. Who are exposed? A. A divided by A plus C versus exposed B divided by B plus D. So, both of them are possible.
Yes.
It means that you can calculate the prevalence of hypercholesterolemia among CHD patients or the prevalence of CHD among hypercholesterolemia. Okay?
Yes.
Why? Because there is no temporality. You measure hypercholesterolemia and CHD at the same time. And your sample is a good sample, is a representative sample, so you can calculate both the prevalence of risk factor and the prevalence of disease in your study sample and compare these two comparisons. Please let me ask a question, an example, and after that we can finish this session. This slide shows us cross-sectional study, rash, and using grape and tomato. Who are consumed grape? These 183. Who used tomato? These 43. Yes? Who have rash? These. Who do not have rash? These. Okay?
2.8.
What is the prevalence of rash among grape user?
2.7.
95
divided by
divided by
183.
all who ate grape. The prevalence of rash who ate tomato. 8
8 divided by 43.
divided by 43. Yes? If I ask you about the prevalence ratio,
2.7.
2.7 prevalence ratio means dividing these two prevalence to each other. Okay? We have another hypothetical example, and I ask you to read it and answer it at home, and ask me if you have any question. Okay? A hypothetical example about CHD and physical activity. Who are CHD patients? These. No CHD patients, exposed and unexposed.
Yes.
I want you to ask this question about the prevalence of CHD among.
1.5. Prevent 1.5.
Did you solve it?
Yes.
Okay. We can review it right now because the prevalence of CHD among physically inactive. Okay. Who are physically inactive? These are. So the denominator is physically inactive individuals. The prevalence of CHD. Who are CHD patients?
10%.
These. Okay? The prevalence of CHD among physically active. Who are physically active? Is 90. 7 are diseased. The prevalence ratio is dividing these to each other. If I ask you about the prevalence ratio of exposure in disease compared to non-diseased, so the denominator should be different. If I ask you about the prevalence of exposure among diseased, 17. Who are exposed? 7. Prevalence of exposure among non-diseased, among this population, 83. And after that, you can divide these two prevalence to each other to find the prevalence ratio. If the prevalence ratio is over than 1, it means that there is a direct association, a positive association between exposure and
disease.
disease. Okay.